So other infections caused by herpes viruses are less prevalent and less known in community, but still they can be dangerous and they are important in some cases. One infection or one virus is cytomegalovirus. As it obvious from the name, virus can cause unique deformation in host cell or cytopathic effect. And as you can see on that right picture marked by error, virus change in appearance of the cell, and cells, host cells became extremely large in size, giant in size, and cyto cell, megalo large. Large cells can be identified in histological studies. So main number of people who are infected with cytomegalovirus, they remain asymptomatic, and actually it can be just accidental finding during some routine checkup because people didn't have any problems with the virus during the first episode of infection. They don't have any recurrent infections, say absolutely no long-term health consequences are observed with that virus. So virulence of virus or contagious abilities of the virus are not very high. It is difficult to, or not so easy to infect another person, as in case of chickenpox, for example. And it's difficult to study virus as well because again, a lot of people remain asymptomatic, a lot of people already infected, but it is thought to be transmitted through body liquids such as saliva, blood, semen, or breast milk. And of course, cases of virus infection transmitted through organ transplantation or blood transfusion are described and known. So nowadays, in some cases, screening for cytomegalovirus is included in organ donors or blood donors to prevent the disease in recipients. So usually clinical manifestations, if they are observed, they resemble infectious mononucleosis, and in rare cases, prolonged fever without any obvious reason or hepatitis symptoms are described. But usually, again, only first episode of infection have some clinical manifestations, and after that, virus remains intact in lymphoid tissues of human body. And reactivation of virus occurs only when some significant immunosuppressive state is observed, usually during HIV infection or some cytostatic therapy during cancer therapy or organ and tissue donation. So we didn't have any treatment for routine cytomegaloviral infections. And again, we have few vaccines which are approved for research and development stage, but they're not indicated for use in humans, and data about those vaccines is limited. So we have only standard precautions of infection transmission during sexual contacts or close contacts with other people. So the most dangerous infection occurred during pregnancy of women or in newborn kids. So congenital cytomegaloviral infections have the most serious consequences, and as you can see on that slide, usually kids suffering from hearing loss or visual loss or damage of central neural system. So the most serious and the most dangerous complication or clinical manifestation of that infection is microcephaly, when kids will have serious deformation of brains. And as you can see on the left picture, it is CT scan of brains of newborn kid. That black kind of butterfly in the center, it is liquor. Actually, here we should have brains, but neural tissue is absolutely absent and replaced with liquor. And usually, severe cases of microcephaly can be easily identified by general appearance of the kid's skull. So usually, we have brain part of the skull prevalent above face or facial skull. But here you can see that in moderate range of microcephaly, both parts are approximately equal, and in severe duration of the disease, brain part is almost absent, and facial skull is much prevalent in size, and those kids have unique appearance, it's easy to identify that it is absolutely significant problem with the brain. Of course, those kids will be very limited in highest mental functions. They will suffer from multiple uh, problems with innervation of tissues, brains, mental abilities, and some of them even will not be viable and will die because of different failures. So we have some data on use of ganciclovir and valganciclovir to improve outcomes of congenital herpes, but again, it's very difficult to use some drugs which are not approved for newborn kids because usually it is very complex procedure to get parents' permission, some ethic committees permission, and others. So data is really limited, but some cases of improvement after that therapy is available. So maybe those drugs will be developed, designed to modify it for using newborn kids, but nowadays treatment is absolutely limited or even absent in some cases in some countries. So if a mother was infected with cytomegaloviral infection and kid delivered healthy, it's still better to check doctor regularly to check hearing and vision abilities because if someone will appear, if some discrepancy will be noticed, it's obligate to initiate anti-cytomegaloviral treatment as soon as possible to improve future outcomes because that loss can be irreversible in the case of absence of treatment. So second virus is Epstein barr virus. It is the positive agent of infectious mononucleosis or just mono. And actually that infection can be caused by some other viruses, but EBV Epstein barr virus is the most frequent pathogen. So name mononucleosis was given because of, again, unique cytopathic effect in host cells. As you can see, it is marked with an arrow. Nucleus or virus of affected cell is changed by virus so significantly it became absolutely enlarged and easy to see. It occupies almost half the cell's space, and those damaged cells are easy to identify. So disease is mainly observed in teenager age or in young adult age when sexual life is in the maximum of activity. And again, it is difficult to study that virus, but it is supposed to be transmitted through saliva, blood, or semen during sexual contacts, and the same transmission through blood transfusion, organ donations are possible and described in medical literature as well. So if you talk about clinical manifestation, only about not less than 25% of infected people will have clinical manifestations. So one quarter of infected people remains absolutely asymptomatic. Incubation period usually lasts for a month, and after that, some few slight symptoms will appear, such as edema and enlargement of lymphoid tissue, which can be identified by checking of oral cavity, or in some cases, it can be visible even through skin. As you can see on that right picture, lymph nodes are enlarged so significantly they became visible through skin even with the naked eye. So first episode of infection can be combined with common fever, muscle pains, body pains, fatigue, and some common symptoms of infection. Usually symptoms will go on in a few days, maximum week, but some cases, especially non-specific symptoms, can last up to 1 month. Disease can manifest with unique type of rashes. As you can see, it is small petechial rashes which can emerge, especially in places where skin is in direct contact with clothes, these knees, joints, or some other parts of the body, and that rashes is of dark color, and usually a combination of lymphadenopathy plus rashes and age of the subject is significant to put the diagnosis, and usually diagnosis is given only by symptoms. But of course, if you need by some reason to confirm the diagnosis, when usually we have PCR as the only available method in any lab, we had some ELISA, but this is not very frequent, and confirmation of diagnosis is not always required. So usually only PCR can confirm your diagnosis. Similar to other viral infections, we don't have any specific treatment, we don't have vaccination, and only standard precautions of sexually transmitted diseases are available. But again, a lot of people remain asymptomatic or latent, and it's impossible to detect that subjects have some problems with herpes viruses. Two viruses which are still only numbered 6 and 7, again, they are not linked to any unique disease, and according to World Health Organization data, massive study was performed, and actually it was identified that more than 95% of people higher 2 years of age already infected with herpes simplex 6. And of course, it's not really possible to identify how disease is transmitted, how is it manifested, because almost everyone is already infected with that disease. And you can link any condition to that virus, and you will not be able to identify, to verify is it really so or not, because we don't have control group to check is that disease observed in people who are not infected with herpes simplex, herpes virus 6 or not. We just have everyone infected and some diseases are present. So the only thing which is confirmed, it is few diseases caused by herpes virus 6, and we have some noticed, and especially that very famous syndrome of chronic tiredness, which can be related as well to herpes virus, but again, it's extremely difficult to be sure that it is really so. So, exanthema subitum, or 6 disease, or 3 days fever, or baby measles, a lot of different names are known for that disease. That condition is for sure caused by herpes virus 6. It is transmitted usually from parents because they are already infected to kids by some contacts through breast milk, through oral, or some saliva contact. It's again difficult to confirm. An incubation period usually lasts for a week or 2 weeks, and disease will start with the high-grade fever up to 40 and even high degrees Celsius, which will remain for a few days without any other symptoms. But after that, rashes will appear on the skin of the kid, which resembles measles, and that's why disease is called as baby measles. And mainly that rashes will be observed only in the trunk of the kid, and sometimes if doctor or parents will check oral cavity, then in epithelium of soft palate and mucous membranes of soft palate, it is possible to identify unique spots which are known as Nagayama spots, or it is enanthem rashes. So in the next picture, I will show you that rashes. You will see what it is. The same manner as for any other herpetic infection, spontaneous convalescence will be observed and treatment usually is not required. Of course, if kids suffering from some disorder, we can give symptomatic therapy, but it is the only thing we can do with ill person. And common reaction in kids on extremely high fever, higher than 40 degrees Celsius, is febrile seizures, and in that case, we will need to give some drugs to release those seizures, because kids even can die because of that serious episode of febrile seizures, and it is the only serious complication of exanthema subitum. So prophylaxis is not available because, again, almost everyone is already infected and we can do nothing here. And actually, I didn't find any data on some vaccines against herpes simplex, herpes virus 6. So maybe someone will be interested, but actually, again, companies usually do not see any profit of vaccination because everyone is already infected and no one will buy that vaccine. Company will lose money. So that is the rashes which appear on the skin. In some way it resembles measles, but actually it's less bright. It is usually pale and pinkish in color. So elements are not merging as the case of measles, and it's easier to differentiate the disease by even appearance of rash elements. And Nagayama spots, which will appear as a pale pink or maybe in some cases red small dots in mucus of soft palate. Again, if you identify that type of rashes, it is for sure herpes simplex or herpes virus 6, because no other diseases in kids' age can manifest with the same manner. The most dangerous virus in rare herpetic virus infection, it is Kaposi-sarcoma-associated herpes virus. So it is one of the most recent viruses identified or discovered in 1994, and actually nowadays it is confirmed to be associated with different types of cancers, especially in AIDS patients. And virus is again poorly studied because actually a lot of healthy people are infected with that virus, and according to different studies, different percentages available. But again, a lot of people are already infected, but until the immune system is good and stable, virus is kept under control and no disorders can be caused by that virus. So nowadays, the highest rate of infection with that virus is described in African countries, and actually rate of prevalence is different in different areas of the world. But again, it's not clearly understood how a virus is transmitted and how to keep it under control. So initially, virus was identified as unique state in AIDS people. Until nowadays, Kaposi sarcoma cancer is known as marker for HIV infection. If subject was not diagnosed before and the subject will go to doctor with Kaposi sarcoma, doctor first of all will check for infection with HIV virus because it is always indicator of the disease. So again, it is thought to be transmitted by sexual contact, but difficult to confirm. And that sarcoma, actually, it is a localized tumor which have very unique appearance. It can be different color macula, so elements which are elevating above the skin, have hyperkeratosis on its surface, can be from bluish red to purple, and sometimes they can be absorbed in mucous epithelium of oral cavity and other organs. So as far as disease is poorly studied, the same way we don't have any specific treatment, and only common measures of cancer therapy such as radiation, cytostatics, or surgical invasion are described for the disease. But again, we can remove tumor local one, but virus remains in our body, and the same disease can appear in other parts of the human body. So here we have improvement of immune statuses, the only method to eradicate disease. And actually, if it is HIV infection, then treatment of HIV. If it is some other reason, then removal of that reason can cure the infection. Actually, it will just give a chance for our immunity to clear the infection, but again, virus will remain in latent stage in our body. So complete therapy is not available. That's all I want to tell you about herpes viruses. See you in other lectures. Bye-bye.